have you ever gotten that like weird feeling like something's just darting across your vision? Or maybe you've seen those like little specks that just kind of float around?
Yeah, those are pretty common.
Well, today we're going deep into those eye floaters and flashes.
Sounds good.
And trust me, it's it's way more interesting than you might think.
Oh, it really is. I think a lot of people just kind of brush it off as part of aging, but
Yeah.
there's so much more to it.
Exactly, and that's what we're going to get into. We've got quite a stack of sources here. We've got patient leaflets, ophthalmologist websites.
Wow.
We even found a blog post from an eye clinic.
Oh, cool.
Our mission is to figure out like what's normal, what's not normal,
Right.
and when should you actually start to worry.
Yeah, good plan.
So almost all these sources mention this thing called the vitreous gel.
Uh-huh.
What is the deal with that?
Well, the vitreous gel is this clear, jelly-like substance that fills up the inside of your eye, and it helps it keep its shape.
Okay.
And it's actually attached to your retina.
Okay.
That's the light-sensitive layer at the back of your eye that acts like the film
Gotcha.
that captures what you see.
Okay, so I'm picturing that, but how does that cause like these floaters I see?
Right.
I think one source described it like a pepper shaker in your eye.
Oh, yeah.
Which is a little, I mean, I guess it's kind of perfect, but it's also kind of disturbing.
Yeah, it's a great analogy. So as we age, that gel can actually shrink and pull away from the retina, and that's called posterior vitreous detachment, or PVD.
Oh, okay.
And as it shrinks, it can clump up
Uh-huh.
and form those little pepper flecks, and they cast shadows on your retina.
So the floaters are actually shadows.
Yeah.
That's crazy.
It is pretty wild.
But then some sources say that floaters could also be blood cells from a hemorrhage,
Right.
which is, I mean, that's a little more alarming.
Yeah, that's where it gets tricky. So most floaters are just harmless collagen fibers,
Okay.
just a normal part of the gel. But if you see blood cells in the vitreous,
Yeah.
that could be a red flag. It could mean there's a retinal tear, a detachment, or even point to some other issues like diabetes or high blood pressure.
Okay, so knowing the typical progression of PVD
Mhm.
could help you tell the difference between like normal changes
Right.
and something like way more serious.
Exactly.
Okay, cool. So while we're on the topic of red flags,
Yeah.
let's talk about flashes. Okay,
Yeah.
you know those lightning streaks that people describe often in their peripheral vision. Those are usually caused by the same vitreous gel
Right.
tugging on the retina, right?
Yeah.
But if both floaters and flashes can happen with PVD,
Uh-huh.
how do you know when to actually worry?
Well, the American Academy of Ophthalmology has some pretty clear guidelines on this.
Okay.
So occasional flashes, floaters that aren't changing much, no vision changes,
Uh-huh.
you're probably fine.
Okay.
But definitely mention it to your eye doctor at your next exam.
Yeah, makes sense.
However,
Yeah.
a sudden increase in flashes, new floaters appearing, or, and this is key, any change in your vision.
Uh-oh.
That's a whole different story.
That sounds serious. Is that where retinal detachment comes in?
Yeah,
A few sources made that sound pretty scary.
it is. Yeah. So retinal detachment is essentially when that film of your eye, the retina,
Right.
starts to peel away from the back of the eye.
Oh, wow.
And because it's responsible for sending those visual signals to your brain, if it detaches, you can lose vision,
Oh, no.
sometimes permanently.
A lot of sources use the analogy of a curtain or like a veil descending over your vision.
Right.
That's a pretty powerful image.
Yeah, and unfortunately, it's a pretty accurate one.
Yikes.
That's why getting immediate medical attention is so crucial if you experience any of those warning signs we talked about.
Yeah, for sure. So retinal detachment, definitely something to watch out for, but we've been focusing on age-related changes in the vitreous gel.
Uh-huh.
But my notes say that there are other less common things that can cause floaters and flashes too, right?
Yeah, you're right.
So some are related to the eye itself, but others, it seems, point to completely different health issues.
Uh-huh.
What are we looking at here?
You're right. There are a lot of other potential culprits.
Okay.
So, for example, some people mistake the visual disturbances that come with migraines for eye flashes.
Oh, okay. So wait, so those zigzag lines and the shimmering lights I get during a migraine,
Yeah?
that's not actually coming from my eyes.
Nope. It's all in your brain.
Really?
Yeah, it's a neurological phenomenon,
Huh.
not an eye problem.
Okay.
So it can be freaky,
Yeah.
but it's usually harmless, and it fades as the migraine passes.
Okay.
But it's always a good idea to talk to your doctor about these visual disturbances,
Yeah.
just to rule out anything more serious.
That makes sense. What about some of these other causes mentioned in the sources?
Sure.
Things like eye stroke, diabetes, even brain tumors?
Right.
I mean, those sound a lot scarier.
Let's break those down one by one.
Okay.
First, eye stroke. So that's actually a blockage of blood flow to the eye,
Okay.
specifically the retina.
Gotcha.
So the biggest takeaway here is that Any sudden loss of vision, whether in one eye or both eyes,
Mm-hmm.
means an immediate trip to the ER. No question.
Wow. Okay, that's definitely one to take seriously. So what about diabetes?
So diabetes is tricky because it can lead to a condition called diabetic retinopathy,
Okay.
and that damages those tiny blood vessels in the retina.
Uh-huh.
And over time, that can lead to vision loss. So that's why managing your diabetes is so important,
Right.
not just for your overall health, but for your eye health as well.
So it's not just about age. Your eye doctor needs to know your full medical history to kind of connect the dots, right?
Absolutely, yeah. Now, we also have less common causes like optic neuritis,
Mm-hmm.
which is inflammation of the optic nerve,
Okay.
brain tumors, and even side effects from certain medications. All
Wow.
of these can cause visual disturbances.
It just goes to show how complex the eye
It
is
really is.
and why a comprehensive eye exam is so important, especially if you're experiencing anything out of the ordinary.
For sure.
Okay, I think we've covered a lot of ground here.
Yeah.
We've got the vitreous gel, we've got PVD, retinal detachment,
Uh-huh.
and then this whole other list of possible causes.
It's a lot to take in.
But I'm guessing if you're listening to this, you're probably thinking, okay, so when do I actually freak out?
Right.
And when can I just relax?
Good question.
So what's like the rule of thumb here?
Okay, here's a good rule of thumb.
Okay.
Sudden increase in flashes, new floaters, or any change in vision, especially that curtain effect,
Uh-huh.
seek immediate medical attention.
Okay.
Don't wait, just go.
Okay, that's pretty clear advice. But what about those occasional floaters or flashes that,
Right.
don't seem to be changing? Are those worth even mentioning?
Well, they're often harmless,
Okay.
but it's still a good idea to bring them up with your eye doctor at your next checkup.
Okay.
They can look at your individual situation,
Yeah.
taking into account your age, your medical history,
Mm-hmm.
and any other risk factors you might have.
Speaking of risk factors,
Yeah.
it's not just about age, is it?
No, it's not.
Our sources mentions a few things that can increase your chances of having problems.
Right.
So go ahead.
Being nearsighted, having a family history of retinal problems,
Uh-huh.
or even past eye trauma can all play a role.
Oh, wow.
Again, your eye doctor needs to know this stuff.
So knowledge is power when it comes to eye health.
For sure.
Hopefully, this is giving you all the info you need to be proactive
Right.
and protect your vision.
Absolutely.
Now, before we move on, there's one thing that really piqued my curiosity
Okay.
while we were going through these sources.
Uh-huh.
They kept mentioning phosphines,
Yes.
which are those flashes that you get from pressure on your eye, like when you rub your eyes.
Uh-huh.
And
Yeah.
phosphines are fascinating.
They are.
Those little sparks of light,
Yeah.
totally normal response to pressure.
Right.
But then they went on to talk about phosphines being caused by things like tumors.
Yeah.
And I was like, wait a minute,
Okay.
that seems a bit contradictory.
Yeah.
Like, what's the connection there?
That's a great question. And it's something for you to think about.
Okay.
How can something as simple as rubbing your eyes be linked to something as serious as a tumor?
Right.
It all goes back to that complex interplay between the eye and the brain,
Mhm.
and how all these different factors can trigger those same visual sensations.
Wow.
It's a bit of a mystery,
Yeah.
but maybe one you can unravel with a little more research.
Okay, so we'll give you a little homework assignment.
There you go.
But in all seriousness, eye floaters and flashes are often nothing to worry about.
Right.
But understanding the warning signs could save your sight.
Absolutely.
Knowledge is power.
You got it.
And hopefully this deep dive is giving you a good dose of it.
I hope so.
So there's a lot more to unpack here.
Yeah.
Let's dive into part 2.
Sounds good. Yeah, and sometimes even those harmless age-related floaters can be like more than just a minor annoyance.
Right.
You know, especially if they're big or if there's a lot of them.
Yeah, I can imagine
Yeah.
some sources mention that they can actually interfere with like reading or driving.
Uh-huh.
I mean, that's no joke.
No, that's not good.
No.
And while there's no like magic cure for those types of floaters,
Right.
there are ways to kind of manage them.
Okay, well, that's good.
Yeah.
One suggestion that I saw was wearing sunglasses in bright light.
Yeah,
That seems pretty straightforward.
it can definitely help reduce their visibility.
Okay.
Yeah, and some eye doctors even recommend specific eye exercises
Oh, really?
just to try and like shift the floaters out of your direct line of sight.
Oh,
But as always, talk to your eye doctor before trying anything new on your own.
yeah, definitely good advice. So we've talked about like what floaters and flashes are and why they happen.
That's right.
But I'm curious about the how now. Like, how do eye doctors actually figure out what's going on?
Well, it all starts with a comprehensive eye exam.
Right.
Usually they'll dilate your pupils,
Okay.
which gives them a clear view of the back of your eye,
Uh-huh.
including the retina and that vitreous gel we talked about.
Right, right. And one source mentions something called funduscopy.
Oh, yeah.
Is that just a fancy way of saying, like, they look into your eye?
It's a little more specialized than that.
Okay.
So funduscopy uses a tool called an ophthalmoscope
Okay.
to examine the fundus,
Gotcha.
which is the interior surface of your eye,
Okay.
opposite the lens.
Uh-huh.
So think of it like taking a picture of the back of your eye.
Okay.
It allows the doctor to see any abnormalities, like retinal tears or detachments
Okay.
or signs of other eye diseases.
That makes sense. A lot of sources also emphasize the importance of a detailed medical history.
Right.
Why is that so crucial for diagnosing eye problems?
Well, as we've touched on, a lot of systemic health conditions can show up in your eyes.
Uh-huh.
Things like diabetes,
Right.
high blood pressure, autoimmune disorders.
Yeah.
They can all leave their mark on the retina and other eye structures.
Oh, wow.
So knowing your medical history helps the doctor kind of put all the pieces together and make the right diagnosis.
That makes a lot of sense. And sometimes they might recommend additional tests too, right?
Yeah, for sure.
Like imaging scans or blood work.
Exactly. Yeah. So if the eye exam raises any red flags,
Hmm.
or if there are like other health issues involved,
Right.
they might need to investigate further.
Okay.
So imaging scans like an ultrasound
Uh-huh.
or OCT, that's optical coherence tomography,
Okay.
can provide detailed images of the eye's structures, helping to pinpoint the problem.
I remember seeing OCT mentioned in a few sources, but they didn't really explain it. So
Right.
what exactly is that?
OCT is a non-invasive imaging technique. It uses light waves to create cross-sectional images of the retina.
Okay.
So it's like getting a 3D view of the back of your eye,
Oh, wow.
which allows for incredibly precise measurements and early detection of even subtle changes.
Huh. That's really cool.
Yeah.
So it's become a crucial tool for diagnosing and managing a variety of eye conditions, including macular degeneration, glaucoma, and diabetic retinopathy.
It really have, yeah.
Wow, so that's some pretty amazing technology.
It is.
So let's say the diagnosis is like a retinal tear or detachment.
Uh-huh.
What happens then?
Well, it depends on the severity.
Okay.
So for minor tears, they might use laser treatment
Uh-huh.
or cryotherapy, which is basically freezing,
Okay.
to seal the tear
Gotcha.
and prevent further detachment.
Okay.
But for more extensive detachments,
Yeah.
surgery is often necessary.
One of the sources talked about a procedure called a vitrectomy.
Right.
So what's involved in that?
So a vitrectomy is a surgical procedure where they actually remove the vitreous gel and replace it with a clear solution.
Okay.
And this gives the surgeon access to the retina
Gotcha.
so they can repair any tears or detachments.
That sounds pretty intense.
It is a delicate procedure.
Yeah.
But thankfully, advancements in technology and surgical techniques have made it much safer and more effective than it used to be.
Okay, that's good.
And in many cases, it can actually save vision that might otherwise be lost.
That's really good to hear.
Yeah, it is.
So once a tear or detachment is repaired,
Uh-huh.
is that it? Like, is everything back to normal?
Not always.
Okay.
So recovery time varies
Yeah.
depending on the person
Okay.
and how extensive the damage was.
Right.
There might be some activity restrictions,
Mhm.
and follow-up appointments with the eye doctor are essential
Right.
to monitor the healing and make sure there aren't any complications.
Okay, so there's definitely a lot to consider with retinal tears and detachment.
For sure.
Shifting gears a bit, I noticed some of the sources mentioned optic neuritis as a cause of floaters and flashes.
Right.
Can you tell us a little bit more about that?
Yeah, so optic neuritis is basically inflammation of the optic nerve,
Okay.
which carries visual information from your eye to your brain.
Okay.
It can cause a range of symptoms,
Mm-hmm.
including pain with eye movement,
Okay.
temporary vision loss,
Right.
and yes, even floaters and flashes.
So what causes optic neuritis?
Well, it can be triggered by a few different things.
Okay.
Most commonly, multiple sclerosis,
Right.
which is an autoimmune disease that affects the central nervous system.
Okay.
Other potential causes include viral infections, certain medications,
Gotcha.
and in some cases, the cause is unknown.
Oh, okay.
And what's interesting is that the symptoms of optic neuritis can sometimes mimic those of other serious conditions,
Oh, wow.
making a thorough diagnosis crucial.
So if someone's experiencing floaters and flashes, along with other symptoms like eye pain or vision changes,
Yeah.
it's important to see an eye doctor right away.
Absolutely, yeah. Early diagnosis and treatment of optic neuritis are essential for preventing long-term vision damage.
Okay.
And thankfully, most people with optic neuritis experience a significant improvement in their vision over time,
Okay, good.
often with the help of medications like corticosteroids.
That's reassuring to know.
Yeah, it is.
It sounds like with eye health, being aware of all the possibilities and acting quickly is key.
It really is.
And there's another area we haven't touched on yet
Okay.
that's just as important as the physical aspects of eye health,
hmm
and that's the psychological impact.
Oh, yeah, that's a really good point.
It's easy to get caught up in like the medical details,
Right.
but these visual disturbances,
hmm
even when they're harmless,
Right.
they can cause a lot of anxiety and stress.
Yeah, especially if they keep coming back or if they seem to be getting worse.
Yeah, that makes sense.
It's understandable that people worry about their vision and fear the worst.
For sure.
And it's important to acknowledge those fears
Mm-hmm.
and address them instead of just brushing them aside.
So what can someone do if they're like really feeling anxious about their eye health?
Well, the first step is talking to their eye doctor.
Okay.
Getting reassurance from a medical professional can often ease those fears and provide some peace of mind.
Yeah, that makes sense.
And if the anxiety is really severe or it doesn't go away,
Yeah.
seeking support from a therapist or counselor might be helpful.
Right. That's a good reminder that health isn't just about our physical bodies,
There.
but, our mental and emotional well-being too.
It really is all connected.
Yeah. Okay. So we've covered a lot of like potential
We
problems,
have.
but what about prevention?
Okay.
Are there things we can do to,
Yeah,
lower our risk of developing these conditions in the first place?
that's a great question.
I mean, surely there's more to it than just hoping for the best, right?
You're absolutely right. While we can't completely eliminate the risk,
Right.
there are definitely things we can do to stack the odds in our favor.
Okay, good.
And it all starts with routine eye exams.
Yeah, I mean, that seems like a no-brainer.
It really is.
You would think so.
Yeah.
Yeah.
Regular eye exams are crucial for catching any potential problems early on when they're most treatable.
Right.
They let the eye doctor monitor any changes in your vision
Uh-huh.
and identify any risk factors you might have.
Right.
And this isn't just about age.
Right.
Even young people should have their eyes checked regularly.
Okay, one source recommended a baseline eye exam by age 40,
Okay?
and then every 2 to 4 years until 65.
Yeah.
And after that, they suggest annual exams.
That's a good general guideline.
Okay.
But your individual needs might be different depending on your overall health,
Uh-huh.
your family history,
Right.
and any existing eye conditions you might have.
Okay.
So talk to your eye doctor to figure out the best schedule for you.
Right, makes sense. Beyond routine exams, what else can we do to protect our eyes?
Okay, so
I mean, there must be more to it than that, right?
absolutely, yeah. Several sources stress the importance of managing any underlying health conditions,
Right.
especially diabetes and high blood pressure.
Right, because those can directly impact eye health.
Precisely. Keeping your blood sugar and blood pressure under control can significantly reduce your risk of developing things like diabetic retinopathy and other eye problems.
Okay, that makes sense.
And speaking of risk factors,
Yeah.
protecting your eyes from injury is crucial.
I remember seeing that trauma to the eye can increase the risk of retinal tears and detachments.
It's true.
Yeah.
Wearing protective eyewear when you're playing sports or doing anything that could put your eyes at risk is so important.
Right, okay.
And even those seemingly harmless habits, like rubbing your eyes too hard,
Oh, yeah.
can potentially damage the delicate structures of your eye.
Yeah, that's true.
So be gentle with those peepers.
Definitely. And finally, don't underestimate the power of a healthy lifestyle.
Oh, for sure.
Eating a balanced diet, getting regular exercise, and not smoking can all contribute to overall eye health.
It all plays a role.
So it's not just about what you do directly to your eyes, it's about taking care of your whole body.
Exactly. Yeah. Eye health is interconnected with overall health.
Makes sense.
What's good for your body is generally good for your eyes.
Right, that's a good point.
So now I know we've covered a lot of ground in this deep dive.
We have.
From understanding the causes and symptoms of floaters and flashes
Uh-huh.
to exploring the diagnosis, treatment, and even prevention strategies.
It's been a lot.
But there's one more fascinating area I'd love to explore.
Ooh, I love a good cliffhanger.
Okay, here we go.
What else have you got up your sleeve?
Well, we've talked a lot about the physical aspects of eye health, but what if we could go beyond simply reacting to problems
Okay.
and instead focus on proactively optimizing our eye health throughout our lives?
Now you've got my attention.
Okay, good.
So what are you thinking?
Well, I think, imagine harnessing the power of, lifestyle choices, nutrition, and even mindfulness practices.
Okay.
Not to, just prevent eye disease, but to actually enhance visual function
Mm-hmm.
and potentially even, slow down the aging process in our eyes.
Whoa, that's like next level stuff. We've been focusing a lot on what can go wrong, but you're talking about actively making things better.
Exactly.
Like unlocking the secrets to not just preserving our vision, but actually thriving visually.
Exactly. It's about pushing the boundaries of what we think is possible when it comes to eye health.
I love that. It's like we're moving from a defensive approach to an offensive one.
Right.
Like proactively strengthening our eyes instead of just trying to protect them.
It's a shift in mindset, and it's an area that's right for further exploration and research.
For sure.
Think about it. What if we could unlock the full potential of our vision?
Yeah,
It's a pretty exciting thought.
it really is. And it makes me wonder, what role could technology play in all of this?
Right.
A few sources mention things like gene therapy and retinal implants.
Yeah, that's another incredibly exciting area.
Yeah.
And it's moving forward so rapidly, we're seeing breakthroughs that could potentially restore vision for people with conditions that were once considered irreversible.
That's mind-blowing.
It is.
It gives me so much hope for the future of eye care.
As it should, we're living in a time of incredible innovation, and the possibilities for improving eye health and enhancing vision seem almost limitless.
So as we wrap up this deep dive, I want to leave our listener with a challenge.
Okay, I like it.
Don't just be like a passive recipient of healthcare.
All right,
Be an active participant in your own eye health journey.
I couldn't agree more. Yeah, empower yourself with knowledge, advocate for your needs, and explore all the options that are available to you.
And remember, taking care of your eyes isn't just about preserving your vision. It's about enhancing your overall quality of life and experiencing the world in all its visual splendor.
Well said.
So keep those eyes wide open, literally and figuratively.
I love it.
There's a whole world of visual wonder out there waiting to be discovered.
That's the truth.
And remember, the journey to optimal eye health is a lifelong one. Take it one step at a time, stay curious, and never stop learning.
Great advice.
Until next time, keep diving deep. 7C67.